Hello everyone, welcome to today's session of Ask FUH. Today's episode is very special to us. With me is Dr. Fahed Kouli. He is our Chief Medical Officer and Consultant Nephrologist. With you, I'm your host today. My name is Sapna. I'm the Head of Marketing Business Development at Fakir University Hospital, and welcome Dr. Fahed to the show.
Thank you very much, Ms. Sapna. Thank you.
I did not introduce, but yes, Dr. Fahed requires no introduction, but let me just give you a brief about it. Dr. Fahed is a well-renowned name when it comes to field of nephrology with more than 25 years of experience in USA as well as in UAE. Dr. Fahed is a busy clinician as well as he is also he has busy administrative responsibilities as a Chief Medical Officer in our hospital. We are talking something very different today, and yes, we know that disease load is extremely high. Today we will speak about kidney diseases, Dr. Fahed, with you, and we will be happy to discuss and have your inputs on this.
Pleasure.
I have very basic questions. When it comes to patients, when do they see a nephrologist?
Actually, that's very good question, as a matter of fact. The reason is that most kidney diseases are silent, meaning they don't hurt. So chronic kidney disease, even acute kidney disease, it doesn't hurt. Very rare circumstances when there is pain in the kidney. And as a matter of fact, most of the patients who come to me with pain thinking it is related to the kidney, it is not. Although it is in the flank area, but there are so many other reasons. And kidney disease is silent, pain only happens if there is a stone and that stone also moved down the ureter, if there is any acute severe infection in the kidney, or if there is an obstruction, rarely due to a very large tumor which cause dull ache and pain but nothing acute. But chronic kidney disease, acute kidney failure has no symptoms whatsoever, and I cannot tell you how many times I had patients either for the first time or they came to me for a second opinion after they found out that they have a kidney problem, which they never knew. Because they tell me I never had pain, which I try to explain to them that kidney disease does not have any pain. But the question, back to your question about who we recommend to see kidney doctors or kidney specialists. There are certain risk factors for kidney disease. The most common cause of kidney disease in our part of the world, as well as in the entire world, is diabetes. Okay. So patients who are known to have diabetes, even if it was discovered last year or this year, they should see a nephrologist periodically to detect the early damage which can happen to the kidney from diabetes. Diabetes is the most common cause of kidney disease. Maybe about 40-45% of the people worldwide who have chronic kidney problem or they are on dialysis are due to diabetes. The second most common cause obviously is hypertension. And many times hypertension and diabetes, they come together. So that will be like a double whammy, basically double risk on the kidneys. And also people with hypertension also need to see a doctor. There is a very strong connection between kidney disease and hypertension. So again, hypertension is a silent disease. Hypertension does not cause, people think that they will only if the blood pressure is high they get a headache. That's not true. Hypertension is very common, especially as we increase in age, and unless they're detected, and that's what everybody calls it, silent killer, it can cause kidney problem. Hypertension can cause stroke, brain hemorrhage, vascular disease, heart disease, of course, and heart failure. So people at risk factors, also people with the family history of kidney disease. Okay. If they have a family history, family members who have chronic kidney problem, they need to see someone. Or anybody who may have some symptoms, let's say change in the color of the urine, change in the consistency of the urine. Many patients come to me, they tell me about their foamy urine. Most of the time it has nothing to do with kidney issues, but if there's any changes in the urine pattern and the urination pattern, if there's any swelling in the legs, that's a very important part that they need to see a nephrologist if they have any swelling in their lower extremities.
Thank you. I think this is very useful information, Dr. Fahed. UAE already has extremely high number of patients suffering from diabetes and hypertension.
Absolutely.
And it's rightly said that they require a nephrologist to take care
Very
of
common,
them.
very
Yeah.
common in the Gulf area.
Yes, doctor. Doctor, second question I will have is diagnosing kidney diseases by nephrologists. So, suppose a typical patient comes to your clinic. How do you diagnose this patient?
Well, it's also a very good question. We evaluate kidney in three simple ways. One of the most important and very simple tests is urine analysis.
Okay.
So simply we take the urine in the clinic and we examine it in the clinic. It takes 1 or 2 minutes, and the urine analysis, it tells us so much about the kidney status, if there is any protein spillage, if there is a microscopic blood in the urine, if there is an infection. So the urine tells us so much, and it's very simple, very easy, very cheap, and very quick test.
Okay.
The other test, which is to evaluate kidney function itself, is a simple blood test. It's a very simple blood test, which the results of it comes out within an hour or so. That also helps us diagnose kidney problem. And the third thing, which is important, is to look at the structure of the kidney, which is by radiologic evaluation, mainly by ultrasound.
Okay.
Sometimes we do use, of course, CT scans, sometimes we use MRI, or even other modalities for certain diseases, but the most commonly used modality is ultrasound, and sometimes we use CT scan for it. So those are really simple, easy. We can get the results very quickly, and we can assure patients about their kidney status, or we can proceed with further work.
Okay. So these are very simple tests which are required for the
Very
the
simple
patients.
test, absolutely.
In addition to that, doctor, what are the specialized services are offered by nephrologists?
Okay, also another good question. Well, we don't only deal with patients with the chronic kidney disease and acute kidney injury, because in the hospital it is not terribly uncommon. Actually, it's fairly common, especially in the setting of intensive care unit, that patient may have acute kidney failure. So we tend to attend to those because the reasons for the acute kidney failure varies among different patients, and it is very common. More importantly, we deal with electrolyte abnormalities. So high sodium, low sodium, high potassium, low potassium, high bicarbonate, low bicarbonate, calcium, high calcium, low calcium. We deal with anemia of chronic kidney disease, of course. This is our part of management. And of course, when the patients unfortunately reach end-stage kidney disease, where they require what we call renal replacement therapy, mainly in the form of dialysis, that's our job to do also dialysis, and there are different modalities for dialysis, or we can guide them toward possible kidney transplant, in certain cases. The other thing, which is very important part of nephrology services, is treatment of hypertension. As a matter of fact, our license, our board certification is in nephrology and hypertension, because those hypertension and kidney disease are very connected. So whenever it becomes very complicated, our primary care colleagues usually send us those patients for treatment, because hypertension can be difficult and it takes some expertise to treat difficult to control hypertension. So that's an important part of it.
All right, doctor. Doctor, in your capacity as Chief Medical Officer at Fahed University Hospital, we have already a surgical institute. But when it comes to kidney diseases, is there any kind of surgical intervention required?
Interesting. Well, the intervention, well, let me start with the simple thing, which is basically many times to be able to confirm certain kidney disease, we, in addition to all the blood tests and x-rays we do, we may need to do a kidney biopsy.
Okay.
Which is simple, usually ultrasound guided, local anesthesia. It is obviously offered in our hospital, being by nephrologists or by our interventional radiologists. It's a simple procedure. Now, above and beyond that, of course, for our dialysis patients, we have the surgical expertise for what we call dialysis access. So somebody need arteriovenous fistula to do dialysis through it, temporary catheter insertion, permanent catheter insertion. Obviously, all these are available to us by our vascular surgeon, general surgeon, as well as by our interventional radiologist.
Right.
All of them have a very, very extensive expertise in managing what we call dialysis access from the surgical point of view. Clotting of the fistula, that also takes some procedure called thrombectomy to remove the blood clot. Also, this is offered in our hospital. Now, we and urology complement each other. So, not infrequently, I end up seeing patients with kidney stones, whether those kidney stones need surgical intervention or not. So we work together with our urology colleague to treat patients with chronic, recurrent, frequent kidney stone, what we call kidney stone formers. So they tend to deal with the acute problem by removing the kidney stone, and we tend to deal with the workup for the etiology why those patients are having recurrent kidney stones. So we do the medical metabolic workup, we call it, to see if there is anything preventable to prevent further formation of kidney stones. And if there is any stone stuck in the urethra or something, they are the one who deal with it.
All right, thank you, doctor. This is the last. Any recommendations for the viewers and the patients, those who are listening to us today?
Also, that's a very interesting question, because my journey in nephrology has been so long, for so many years, and I've seen all kinds of scenarios. Right. So not only patients, if I have to say one word to anybody, and I tell to friends and family and everybody around me, patients and everyone, that as kidney disease is silent, not only the ones who have the risk factors for it, such as diabetics or hypertensive patients or family history, but also the public, because I cannot tell you how many times we have discovered kidney problem in patients who do not have those risk factors, because there are so many other reasons for patients to have kidney issues, even kidney tumors. Most of the kidney tumors, we find them accidentally, because most of the time patients don't have any symptoms, the kidney cancer. We find them accidentally, either by testing the urine, we find microscopic blood, or by doing ultrasound for different reason for the abdomen, and we find it. So my message, at least even for the healthy people, and I think in some advanced countries they do it even in schools, that once a year, even for kids and adults, to have at least urinalysis once a year. Urinalysis, as I said, is extremely simple, extremely cheap test, but provides so much information. If there is anything abnormal, then further investigation will be needed. But this is very quick, very cheap test, and maybe for people who are at risk for kidney cancer, or especially there's a family history or other signs or symptoms, may need to have an ultrasound maybe every few years, maybe every 5 years or something. Although it's not the guidelines, but because we've seen a lot of kidney tumors, which is more related to our urology colleague, but I end up also seeing those patients as well for different reasons. So this is my recommendation, but at least urinalysis for even ones who feel perfectly healthy, because we can detect a lot with this cheap test.
Okay. Interesting, doctor. It's a very simple recommendation for everyone, and thank you so much. Today we wrap up our Ask FUH with Dr. Fahed Kouli, and see you next week. Thank you so much.
Thank you very much for hosting me. Thank you.
Doctor.
Really
Thank you
appreciate
so
it.
much.
Thank you. Thanks.